Hey everyone, and welcome back for another deep dive. Today we're tackling a topic that's absolutely fundamental for nursing students and seasoned pros alike, the incredible world of skin, hair, and nails. Now we've got some excerpts from a textbook chapter on this subject, and we're going to dissect all the must-know info.
To help you ace those patient assessments.
Exactly.
And really level up your overall care.
So let's jump right in.
You know, it's easy to take skin for granted.
Oh, totally.
But for nurses, understanding this intricate system, it's absolutely vital. It can really be a window into a patient's overall health.
I'm excited to dive in and learn all the practical tips and tricks. First off, when we talk about skin, we're talking about an organ, right?
Yes.
Not just a layer.
An organ.
And a pretty major one at that.
You got it. It's actually our heaviest single organ, believe it or not.
Oh, wow.
We're talking about 16% of your total body weight, folks.
That is wild. So it's not just sitting there looking good.
No.
What are some of those crucial functions it's performing?
Well, think about it. Skin is our first line of defense against all those nasty microbes.
Mm-hmm.
And environmental hazards. It helps regulate our temperature, keeping us from overheating or freezing.
Oh, yeah?
It even plays a role in making vitamin D from sunlight. And let's not forget its role in fluid balance, keeping everything from drying out.
It's a real multitasker.
It is.
But I'm curious about what's going on beneath the surface. What are the key layers we need to know?
All right, let's peel back the layers, so to speak.
Okay.
We've got three main ones: the epidermis, the dermis, and subcutaneous tissue.
Okay.
Think of the epidermis as that tough, waterproof outer layer. It's constantly regenerating itself, shedding those dead skin cells to keep that barrier strong.
Okay.
Fun fact, this is the layer you need to consider when applying topical medications.
Oh.
Some meds need a special formulation to actually penetrate effectively.
Ah, so that's why some creams are thicker than others.
Yes.
It's not just about feeling fancy.
Exactly.
What about the dermis?
The dermis is where things get really interesting.
Okay.
It's a complex network of collagen and elastin, giving skin its strength and elasticity.
Right.
This is where you find all those important structures: hair follicles, sweat glands, and those sensory nerve endings that let us feel the world around us.
Oh.
You know that tingling sensation you get when you touch something soft?
Yeah.
Thank your dermis.
Wow. I'm starting to see how each layer is so specialized. What about that subcutaneous layer? Isn't that mostly fat?
You're right. The subcutaneous tissue, or hypodermis, is largely made up of fat cells.
Okay.
This layer acts as insulation, cushions our organs, and stores energy. Think of it as our body's natural padding.
Okay, layers make sense. But what about the amazing variety of skin colors we see? I know melanin plays a big part, but is there more to the story?
You bet. While melanin is the primary pigment, skin color is actually influenced by several factors.
Like what?
We've got hemoglobin in our blood, which carries oxygen.
Right.
When it's oxygen-rich, it gives skin that healthy rosy hue. But if someone is anemic, their hemoglobin isn't carrying as much oxygen, and their skin can appear pale.
So that's why checking for pallor can be such an important clue in a patient assessment.
Yeah.
What about those bluish tones we sometimes see?
That's cyanosis, and it can be a sign of a serious problem.
Oh.
Think of it this way. Ever notice how your fingertips turn blue when you're freezing?
Uh-huh.
That's cyanosis in action. It means the blood in that area isn't carrying enough oxygen.
Now, I'll never look at blue fingertips the same way again. But what about those yellowish tones we sometimes see in patients?
That can be jaundice, caused by a buildup of bilirubin in the blood. Bilirubin is a byproduct of red blood cell breakdown. When it accumulates, it can cause a yellowing of the skin and the whites of the eyes.
This is fascinating. It's like a whole new language of skin color. I'm already feeling like a much better observer. But let's not forget the other key players, hair and nails.
Absolutely. Hair and nails can also provide valuable clues about a patient's health.
I know we all have those fine, almost invisible vellus hairs, and the thicker, more obvious terminal hairs.
Yeah.
But nails always seemed a bit mysterious to me. What should we be looking for when assessing them?
Nails are like tiny time capsules, reflecting a patient's overall health. You want to pay attention to the nail play itself, its color, shape, and texture. Is it smooth or pitted? Is there any clubbing? That can be a sign of lung or heart problems, so it's a big red flag.
So many details packed into those tiny structures. And what about nail growth itself? I remember that could be significant too, right?
Right. Fingernails grow surprisingly consistently, about 0.1 millimeters a day.
Wow.
Toenails, however, take their sweet time.
Oh.
Any changes to this growth rate, like slowing down or uneven growth, can be a signal of underlying issues, from nutritional deficiencies to problems with circulation.
Wow, I'm learning so much already. Okay, let's shift gears to those glands we mentioned earlier, the ones responsible for oil and sweat.
Great idea. Let's start with the pilosebaceous glands, also known as oil glands.
Okay.
They're found almost everywhere except our palms and soles.
And their job is to keep our skin lubricated.
Exactly. They produce sebum, an oily substance that moisturizes and softens our skin, and even has some antimicrobial properties.
Makes sense. So what about the sweat glands? They're the ones that get us into trouble with body odor, right?
Well, it's not that simple. We have two types of sweat glands, eccrine and apocrine.
Okay.
Eccrine glands are all over our body and produce that watery sweat we all know and sometimes dread when we exercise or get hot.
Right.
It's our body's way of cooling down, essential for maintaining a healthy temperature.
Ah, so it's all about thermoregulation.
Yes.
What about the apocrine glands? Those are the smelly ones, right?
Those are the ones that often get a bad rap. They're primarily found in our armpits and groin, and their secretions are thicker and oilier. This is where bacteria come in,
Okay.
breaking down those secretions and producing those, shall we say, distinctive aromas we associate with body odor.
So it's not the sweat itself, but the bacteria having a party that causes the smell.
Precisely. But remember, some degree of body odor is perfectly normal. It's only when you see sudden changes, excessive sweating, or a drastically different odor that it might warrant further investigation.
Okay, we've covered a lot of ground here.
We have.
We've got the basics of skin anatomy, those fascinating factors that influence skin color, and a glimpse into the world of hair and glands. But how do we actually apply this knowledge? When we're face-to-face with a patient, that's where the rubber meets the road, right?
You're absolutely right. And that's what we'll dive into next, the art of taking a thorough patient history and using that information to guide our physical assessments.
Okay.
Stay tuned for that in the next part of our deep dive.
I can't wait.
You know, before we jump into the physical exam itself, there's a crucial step we need to cover.
You're talking about taking a thorough patient history, right?
Absolutely.
I'm all ears because I know that's where we gather those essential clues
Yes.
that can really guide our assessment.
A well-taken history is like a roadmap.
Oh, I like that.
It helps us zero in on areas of concern, understand the patient's perspective, and tailor our approach to their individual needs.
Okay, so what are some key questions we should be asking when it comes to skin, hair, and nails?
Well, it always starts with open-ended questions.
Okay.
Encourage them to tell their story in their own words. You might say something like, "What brings you in today regarding your skin?" Or, "Have you noticed any changes in your skin, hair, or nails recently?"
So instead of asking, is your skin itchy?
Right.
I should say something like, tell me about any sensations you're experiencing with your skin.
Exactly. It's about giving them the space to describe their experience without leading them to a specific answer.
That makes sense. It's all about letting the patient guide the conversation. Once they've shared their concerns, what kind of details should we be digging into?
It's all about the timeline
Okay.
and associated symptoms. Ask them when they first noticed the issue. Has it changed at all over time? Is it getting better or worse? And are there any other symptoms that go along with it, like itching, pain, or bleeding? For instance, if they mention a rash, does the itching come before or after the rash appears?
Oh, that's interesting.
That can give us valuable clues about the underlying cause.
It's like detective work for the skin.
You got it.
We're gathering all these pieces of the puzzle to get a clearer picture.
And don't forget to ask about their medical history.
Right, of course.
Do they have any chronic conditions like diabetes, eczema, or psoriasis? Are they taking any medications, especially new ones?
Right, medications can definitely have side effects that show up in the skin.
Exactly. And allergies are important too.
Okay.
Ask about environmental allergies like pollen or pet dander, as well as food allergies. Those can also manifest in the skin.
So we've covered the present and the past. What about family history? Is that something we should be asking about?
Absolutely. Family history can be a huge clue, especially when it comes to skin cancer.
Okay.
Ask about any family history of skin cancer, particularly melanoma. It's one of the most important risk factors to be aware of.
So even if a patient doesn't have any concerning moles themselves,
Yeah,
if their mom or dad had melanoma, that increases their risk?
precisely. It's all about understanding their overall risk profile.
Okay.
And finally, don't forget to ask about their lifestyle and habits.
Right, like sun exposure.
Exactly. Do they spend a lot of time in the sun? Do they use tanning beds? What kind of skincare products do they use? Do they have any occupational exposures that might affect their skin? All these factors can play a role in their skin health.
Wow, this really highlights how important it is to be thorough and ask those detailed questions. It's not just about looking at their skin.
No.
It's about understanding the whole picture.
You hit the nail on the head. A thorough history is like building a strong foundation. The more information we have, the better equipped we are to assess and address their concerns.
Okay, we've laid that groundwork with a comprehensive patient history. Now let's move on to the physical exam itself.
All right.
Where do we even begin? The skin is such a vast and complex organ.
You're right. It can feel overwhelming. That's why it's crucial to have a systematic approach.
Okay?
We want to be thorough and ensure we're not missing any important details.
Okay, all ready for the game plan.
Great. There are two common positions we use for a full-body skin exam.
Okay.
Seated, and supine prone, which means lying face down.
Okay.
We'll go over both. But the key with either position is to follow a head-to-toe approach, examining each area carefully.
Sounds good. Let's start with the seated position. What are our first steps?
We begin with the hair and scalp.
Okay.
Take a good look at the distribution, texture, and quantity of the hair. Are there any areas of thinning or baldness? Is the hair dry, brittle, or excessively oily? You want to get a sense of the overall condition.
And I'm guessing we're also looking for anything unusual.
Yes.
Like lesions or signs of infestation.
Exactly. Look for any lice nets or scaling that could indicate dandruff or other scalp conditions.
So we're not just looking at the hair itself.
Right.
We're examining the scalp as well.
That's right. It's all connected. Okay, once we've assessed the hair and scalp, we move on to the face.
Ah, the face. I know this is a prime location for all sorts of skin issues.
You're not wrong. Inspect the skin on the face carefully, paying attention to color, texture, and any lesions. Look for symmetry or asymmetry, any areas of redness, swelling, or unusual pigmentation.
And I remember from our prep that basal cell carcinoma, or BCC, often shows up on the face.
Excellent point.
What are some telltale signs we should be looking for?
BCC can be sneaky. It often appears as a pearly or waxy bump, sometimes with visible blood vessels.
Oh, okay.
It can also look like a flat, flesh-colored or brown scar-like lesion. The key is to look for anything new or changing, anything that looks different from the surrounding skin.
So if we see something that looks suspicious,
Yes.
we should always err on the side of caution and refer the patient to a dermatologist.
Absolutely. Early detection is crucial when it comes to skin cancer. We want to catch it as early as possible.
Okay, face is checked off the list. What's our next stop on this head-to-toe tour?
Next up are the ears.
Okay.
Inspect both the front and back of the ears, looking for any redness, scaling, or discharge.
And then we move down to the neck, right?
You got it. Examine the skin on the neck, both the front and back. Pay attention to any enlarged lymph nodes, which could be a sign of infection or other problems.
And I'm guessing we're also on the lookout for any unusual moles or lesions on the neck.
That's right.
Just like we were on the face.
Consistency is key in our exam.
Okay, neck is done. What's next on our list?
Now we move on to the shoulders, arms, and hands.
Wow, okay.
Take your time examining the skin on the shoulders, arms, and hands, paying attention to both the front and back.
I've heard that the hands can reveal a lot about a person's overall health.
You're right.
What are some specific things we should be looking for in this area?
The hands can provide valuable clues. Look for any signs of clubbing, which we discussed earlier.
Right.
It's a subtle but significant finding. Also, check the palms for any redness, dryness, or calluses.
And of course, we can't forget about the nails.
Absolutely not. Inspect each fingernail carefully, noting its color, shape, and texture. Are they smooth or pitted? Brittle, discolored, or thickened? Is there any separation of the nail from the nail bed? We call that onycholysis.
Wow, there's so much to consider when examining the nails. I'm realizing that a thorough skin assessment really involves a keen eye for detail.
It absolutely does. We're looking for subtle clues that can help us piece together a patient's overall health picture.
Okay, so we've done the hands. Now we move on to the chest and abdomen.
Yes.
You'll need to ask the patient to adjust their gown so you can examine the skin in these areas.
And I'm guessing this is where we'd pay particular attention to any moles.
Right.
Given that melanoma is a major concern.
You're right on track.
Carefully inspect any moles, looking for those ABCDE-EFG features we talked about
I
earlier.
remember.
Asymmetry, border irregularity, color variations, diameter, evolving, elevated, firm, and growing. And don't forget to check the skin under the breasts and in the armpits,
Right.
as those areas can be prone to rashes and irritation.
Makes sense.
We want to be thorough and cover all the bases.
Okay, so we've examined the chest and abdomen. What's next on our journey?
It's time to turn our attention to the back.
Okay.
Have the patient sit up slightly so you can get a good look at their back. Inspect the skin carefully, looking for any moles, lesions, or areas of redness.
And I'm thinking this is also a good time to check the buttocks, right?
Absolutely.
Especially for those pressure injuries we discussed earlier.
Pressure injuries are a serious concern. Especially for patients who are bedridden or have limited mobility, we want to be vigilant in inspecting the skin over bony prominences, like the sacrum, buttocks, hips, and heels.
So we're looking for any redness, discoloration, or breaks in the skin
Right.
that could indicate a developing pressure injury.
Exactly. Early detection is key, so we can intervene and prevent further damage.
Okay, back and buttocks are done. Where do we head next?
It's time to move on to the legs and feet. Examine the skin on the legs, both front and back, looking for any varicose veins, swelling, or discoloration. We also want to be mindful of any signs of poor circulation, especially in patients with diabetes or other conditions that affect blood flow.
So we're looking for things like coldness, pallor,
Yes.
or decreased sensation in the legs and feet.
Precisely. Those can all be red flags. And don't forget to carefully examine the feet, including the soles, heels, and toes. Look for any sores, ulcers, or signs of infection. Inspect the toenails just as you did the fingernails, looking for any abnormalities. The feet are often neglected, so it's important to give them a thorough examination.
Wow, we've covered a lot of ground.
We have.
We've literally gone from head to toe in our skin assessment.
And remember, this is just a general framework.
Okay.
The specific details of your exam will always vary, depending on the patient's individual needs and concerns.
That makes sense. But I'm feeling much more confident in my ability to conduct a thorough and systematic skin assessment now.
That's great to hear. And remember, practice makes perfect. The more you do these exams, the more comfortable and proficient you'll become.
I'm definitely going to be practicing my observation skills from now on. Every patient interaction is a learning opportunity.
You got it. And don't be afraid to ask for guidance from more experienced nurses or healthcare providers. We're all here to learn and support each other.
This has been such an enlightening deep dive. I feel like I've gained a whole new appreciation for the complexities of the skin and its importance in overall health.
I'm so glad to hear that. And remember, the skin is our largest and most visible organ. It's truly a window into what's going on inside the body.
That's a powerful reminder.
So we've covered the art of taking a patient history and the step-by-step approach to conducting a full-body skin exam. Is there anything else our nurses should keep in mind as they continue their nursing education and embark on their careers?
What else?
You know, one of the most important things for nurses to remember is that we're not just treating conditions. We're treating people.
That's such an important point. It's about seeing the whole person, not just the disease.
Exactly. And when it comes to skin conditions, it's especially important to be sensitive and empathetic.
Oh yeah, for sure.
Skin conditions can be very visible and can significantly impact a person's self-esteem and quality of life.
I can only imagine how challenging it must be to deal with a chronic skin condition that affects your appearance.
It can be incredibly difficult. So as nurses, we need to approach our patients with compassion and understanding.
Yeah.
Listen to their concerns, answer their questions, and provide support and encouragement.
That's such valuable advice. It's a reminder that nursing goes beyond the technical skills. It's about building relationships and providing holistic care.
Absolutely. And remember, we're all in this together. By working collaboratively with our patients, we can help them achieve the best possible outcomes for their skin health and overall well-being.
This has been an incredible deep dive. I feel much more confident in my ability to approach skin assessments and advocate for my future patients' skin health.
That's fantastic to hear. But you know what? We've only just scratched the surface.
Well,
There's so much more to learn and discover about this amazing organ.
I'm ready to keep diving deeper. What's next on our skin adventure?
Well, in the next part of our deep dive, we'll explore the remarkable world of wound healing.
Ooh.
We'll unpack the intricate processes that allow our skins to repair itself and discuss some key strategies for optimizing healing and minimizing scarring. Stay tuned for that.
All right, we've covered a ton of ground so far, from skin anatomy and those fascinating glands to the art of taking a detailed patient history and conducting a thorough head-to-toe skin exam. But there's one more topic I'm really excited to dig into: wound healing.
It's a process that never ceases to amaze me.
I know.
The skin's ability to repair itself after an injury is truly remarkable.
Even a simple cut healing over seems like magic sometimes. What's actually going on at the cellular level when a wound starts to heal?
It's a beautifully orchestrated cascade of events, involving a whole cast of cellular characters and signaling pathways. But let's try to break it down into a few key stages, shall we?
Absolutely, I'm ready to take notes.
Okay, so picture this. You get a cut. The first thing that happens is your blood vessels constrict, trying to minimize blood loss.
Okay.
Then those tiny cell fragments in our blood, the platelets, rush to the scene and clump together, forming a clot to plug that wound.
So that's what a scab is.
Yes.
A bunch of platelets doing their heroic duty.
You got it. They're like the first responders of the wound healing world.
Wow.
And while they're busy forming that clot, other specialized cells called neutrophils and macrophages are being recruited to the site of the injury. They're like the cleanup crew gobbling up bacteria and debris to prevent infection.
It's like a microscopic battleground down there. So what happens once the wound is all cleaned up? How does the actual rebuilding process begin?
That's where the fibroblasts come in.
Okay.
These are the amazing cells that produce collagen, which acts like scaffolding for new tissue. They start laying down new connective tissue to bridge the gap in the wound.
Ah, so collagen is like the building blocks for new skin.
Exactly. And while the fibroblasts are hard at work, new blood vessels start sprouting, bringing oxygen and nutrients to the healing tissue. That's why you often see that reddish, slightly raised tissue we call granulation tissue. It's a sign that healing is progressing nicely.
This is blowing my mind. It's incredible how our bodies orchestrate all this without us even thinking about it.
It really is a testament to the power of nature. And as this new tissue matures, those keratinocytes we talked about earlier, the ones that make up our epidermis, start migrating from the edges of the wound inward, eventually forming a new layer of skin.
So it's like the skin is rebuilding itself brick by brick from the bottom up.
That's a great way to put it. And over time, that scab, who has served its purpose, sloughs off, revealing the newly formed skin underneath.
Okay.
Now, depending on the depth and the severity of the wound, there might be a scar.
Right, so why do some wounds leave scars while others heal perfectly? What determines that outcome?
It's a complex interplay of factors: the depth and location of the wound, the individual's genetics, their age, their overall health, and even their skin tone. Sometimes when the dermis is damaged, the body replaces it with fibrous tissue instead of normal skin, resulting in a scar.
So scars are basically a sign that the body did its best to repair the damage, even if it couldn't perfectly replicate the original skin.
Exactly. And while scars might be a cosmetic concern for some people, they're also a reminder of the skin's remarkable resilience, its ability to heal and adapt even after significant trauma.
I'm looking at my own skin in a whole new light now, but I'm curious, are there things we can do as nurses to promote optimal healing and minimize scarring in our patients?
Absolutely. Proper wound care is essential.
Okay.
Keeping the wound clean and moist, protecting it from further injury, and ensuring the patient is getting adequate nutrition all play a crucial role.
So the old saying of letting a wound air out is actually not the best approach.
Not really. A moist wound environment has been shown to promote faster and more efficient healing. Think of it this way: a dry wound is like a cracked desert floor,
Oh.
while a moist wound is like a lush rainforest teeming with life.
That's such a vivid image. It makes perfect sense. What about those over-the-counter creams and ointments that claim to reduce scarring? Do they really work?
Some of them can be helpful. Silicone gel sheets and ointments, for example, have been shown to improve the appearance of scars. And there are also prescription medications and laser therapies that dermatologists can use to minimize scarring.
Wow, there's a lot more to wound healing than I ever realized.
It's a whole fascinating field of study in itself.
This entire deep dive has been such an eye-opener. I feel like I've gained a whole new understanding of the skin's complexity and importance.
I'm thrilled to hear that. And remember, we've only just scratched the surface. There's a wealth of information out there waiting to be explored.
Well, I'm definitely leaving this deep dive feeling more knowledgeable and confident in my ability to approach skin assessments, provide informed care, and advocate for my future patients' skin health.
That's wonderful. And remember, never stop learning. Keep that curiosity alive, keep asking questions, and keep that passion for nursing burning bright.
Beautifully said. And to our amazing listeners, thanks for joining us on this incredible journey into the world of skin, hair, and nails. We hope you've learned something new and that you'll walk away with a renewed appreciation for this incredible organ.
And don't forget to check out the show notes for additional resources and information on this topic. There's always more to explore.
Until next time, stay curious, stay informed, and keep on learning.